The biggest mistake seniors make in an emergency happens before the ambulance even turns onto the street. And in those first 3 minutes, your next move can protect your brain, your heart, or put you in even more danger. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share science-backed health tips like this every single day. After years of watching the same pattern again and again, one thing stands out. It's usually not one giant mistake that causes trouble. It's a string of tiny delays. You wait to see if it passes, you call family first, you try to stand up, you go look for your pills. And while all that is happening, your body is losing time it cannot get back. Here's the thing, when something serious starts like sudden chest pressure, one-sided weakness, slurred speech, a hard fall, or sudden confusion, those first minutes are not empty minutes. They are active medical minutes. What you do before help arrives can lower your risk of a worse outcome. And today I'm going to give you a simple 3-minute emergency technique you can remember under pressure. Now before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think the job starts when the paramedics arrive. It doesn't. It starts the second your body does something strange and sharp and sudden. Most people think they should wait, rest, drink water, check their blood pressure 3 times, or call their son or daughter first. But actually the safest first move is usually to treat the moment like a real emergency and start the process immediately. And that matters more than you may realize. A 2024 study from Yale School of Medicine found that 54% of stroke patients got to the hospital more than 2 hours after symptoms began. That is a lifetime in an emergency. Another 2023 study from the University of Chicago Medicine found that nearly 75% of stroke patients being transferred for advanced care waited more than 2 hours, with a median delay of 174 minutes. Look at that for a second. Not a few extra minutes, hours. Why is that so dangerous? Because your brain is not a storage closet. It's more like a busy city that needs constant power. When blood flow drops, traffic lights fail, roads jam, and whole neighborhoods shut down. The same is true with your heart. When oxygen is cut off, heart muscle starts suffering fast. So no, the first 3 minutes are not for guessing, they are for action. Number 5, stop moving. Most people think they should get up, walk it off, or finish what they were doing, but actually sudden movement can make a bad situation worse. If you're having chest pressure, dizziness, sudden weakness, or a fall, your body needs stability first. Think of it like slamming the brakes on a car before you steer, not motion, but control. A 2024 study from Yale School of Medicine found that more than half of stroke patients arrived late, and those with milder or stranger symptoms were especially likely to delay. That means the danger does not always feel dramatic. Sometimes it feels like I'm probably okay. That is exactly why this step matters. So what do? The second you feel sudden symptoms, stop where you are. If you are standing, hold on to something solid and lower yourself slowly into a chair. If a chair is not close, sit on the floor against a wall. If you already fell, do not pop back up quickly. Stay still for a moment. Take one hand and place it on your chest or thigh. That sounds small, but it helps anchor your body and focus your mind. Then take 6 slow breaths. In through your nose for 4 seconds, out through your mouth for 6. Why breathe like that? Because panic makes everything noisier. Slow breathing helps you think clearly without pretending nothing is wrong. If you feel faint, lie flat, only if you can breathe comfortably. If you feel short of breath, stay upright. If you feel sick to your stomach, turn onto your side if you can do it safely. Not proud but safe, not fast but smart. And let me be clear, this is not the moment for a snack, coffee, or just a little water if you have stroke signs, choking, or trouble swallowing. If your face is drooping, your speech is off, or your arm feels weak, keep food and drink away. You do not want liquid going into the wrong pipe, but wait until you see number 4, because this is where most people lose precious time. Number 4, call first, not family first. Most people think they should call a loved one and ask what to do. But actually that often adds delay, confusion, and travel time. If you think you may be having a stroke, heart attack, or serious fall injury, call emergency services first. Then family can be contacted after help is already on the way. A 2023 study from the University of Chicago Medicine found that when emergency medical services called ahead about a stroke patient, transfer times dropped by about 20 minutes. That is huge. Why? Because calling emergency services does more than send a ride. It starts a chain. The dispatcher listens, the crew prepares, the hospital gets ready, your call becomes a moving signal. Here's exactly how to do it. Use your phone on speaker. If you wear hearing aids, keep them in if possible. Say your address first, twice, then say your name and age. Then say the symptom in one short sentence. I am 74, sudden chest pressure. Or I am 81, my speech got slurred 5 minutes ago. Or I fell and cannot get up. Short sentences work best. Not a long story, but the emergency. If you have a medical alert button, press it and still keep speaking if the system allows it. If you are alone, do not hang up unless told to. Put the phone beside you. Follow instructions exactly. If they ask you to unlock the door, do it if you can do it safely. If they ask about medicines, answer only what you know. Quick question. Have you ever had sudden dizziness, chest pressure, or fall that scared you? Comment yes or no below. Now here is something else people miss. A 2020 study from Sunnybrook Health Sciences Center, which is fully affiliated with the University of Toronto, found that older adults with stroke used an ambulance more often than younger adults, and younger adults who did not use an ambulance took more than 2 hours longer to reach the hospital. The lesson is simple. Not a car ride, but emergency transport. Not I'll drive myself, but get the team moving now. But wait until you see number 3, because help coming is only part of the job. Number 3, unlock, light, enlist. Most people think once they've called, they can just sit and wait, but actually the next 60 seconds can make the arrival smoother and safer. Think of it like setting the table before dinner arrives. You are not doing extra work, you are removing friction. If you can move safely, unlock the front door. Turn on the porch light if it is dark. If you live in an apartment, buzz the main door open if possible. Move rugs, walkers, or small tables out of the path. If a pet may run toward the door, put the pet in another room if you can do it without strain. Then make one small pile near you or near the door. Put your phone, glasses, Idaho, medication list, and any pill bottles you use every day in that spot. If you use oxygen, an inhaler, nitroglycerin, insulin, or a blood thinner, bring those to the pile too. Why does this matter? Because emergency care runs on information. If your body is the patient, your medication list is the map. And this is not just about convenience. A 2024 review in JAMA Network Open found that older adults prescribed potentially inappropriate medicines were 91% more likely to have a medication-related hospitalization, 60% more likely to have functional decline, and 26% more likely to have an adverse drug event. In plain English, medicine mistakes hit older adults hard. So when help arrives, having the right list ready is not paperwork, it is protection. What should be on that list? Your full name, your date of birth, your allergies, your major conditions like diabetes, heart disease, stroke, kidney disease, or seizures, then every medicine you take, the dose and how often. Write warfarin, apixaban, or blood thinner clearly if that applies to you. Write insulin clearly if you use it. Keep one paper copy by the phone and another in your wallet. Fancy app or plain index card, both work. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this, but wait until you see number 2, because this is the step that can help you avoid one of the most dangerous mistakes of all. Number 2, match the move to the symptom. Most people think one emergency trick works for everything, but actually the right move depends on what your body is doing. A stroke is not a fall, a heart attack is not low blood sugar, and mixing them up can get you into trouble. Let's keep this very simple. If you have sudden face drooping, arm weakness, speech changes, sudden confusion, new balance trouble, or sudden vision loss, think stroke, not later, but now. A 2024 study from Sahlgrenska University Hospital in Gothenburg found that only about 30% of mild strokes showed the classic FAST pattern. That means not every stroke looks like the textbook. Sometimes it is just strange balance, numbness, or vision trouble. So do not wait for dramatic symptoms before you act. If you think stroke, do not eat or drink. Do not take aspirin unless emergency professionals tell you to. Do not go back to bed, sit safely, call, and watch the clock. If you have crushing chest pressure, tightness spreading to the arm, jaw, back, or sudden sweating with nausea, think heart attack. If your doctor has already told you to use nitroglycerin, take it exactly as prescribed. If emergency services tells you to chew aspirin, or your own doctor has previously instructed you to do that for suspected heart attack and you are not allergic and not actively bleeding, chew it as directed. Chewing helps it work faster. But this matters. Not aspirin for every problem, only for the right one. Why so careful? Because a 2018 study from Monash University in the ASPRE trial found that in healthy adults over 70, daily low-dose aspirin did not lower the risk of a first heart attack or stroke enough to outweigh the increased risk of bleeding. In other words, aspirin is powerful, and powerful things need the right reason. If you have diabetes and your blood sugar is under 70 and you are fully awake, use the 15-gram rule. Take 15 grams of fast sugar. That can be 4 glucose tablets, 4 ounces of orange juice, 4 ounces of regular soda, or 1 tablespoon of honey. Wait 15 minutes and recheck if you can. But if you are confused, sleepy, or unable to swallow safely, do not force food or drink. Call for help. If you fell and hit your head, or you are on blood thinners, treat that fall seriously even if the pain feels mild. If you cannot bear weight, have a twisted leg, heavy bleeding, or new confusion, stay still and wait for help. See the pattern? Not one size fits all, but symptom-matched action. That is how you help your body instead of guessing against it. But wait until you see number 1, because this final step is the one paramedics wish every senior knew. Number 1, start the clock and talk like a medic. Most people think they need to explain everything, but actually the fastest help comes from the clearest words. Think of your words like road signs, not a whole travel diary, just the signs that point the team where they need to go. A 2021 study involving senior learners at universities of the third age and BRNO found that after stroke education, preparedness improved from 80% to 87%. That may sound modest, but it proves something important. When older adults know what to say and what to do, they act better under pressure. So here is the script. Say when the symptom started. 10 minutes ago. At 7:20, I woke up like this at 6 o'clock. If you do not know the exact time, say the last time you felt normal. Then say the main symptom. Sudden left arm weakness, new slurred speech, crushing chest pressure, passed out and fell. Then add the one medical detail that matters most. I take a blood thinner. I have diabetes. I took nitroglycerin. I hit my head. That is it. Time, symptom, key history. Why is time so important? Because treatment windows are real. Some stroke medicines have to be given within hours. Some heart treatments work better the sooner blood flow is restored. If you cannot speak clearly, point to a clock or show the dispatcher or family member the time on your phone. If someone is with you, tell them to write it down. I'd love to hear your story. What made you click on this video today? Share in the comments. And one more thing. If someone else is helping you, have them do a simple check. Ask you to smile, raise both arms, say a short sentence. If one side drops or speech sounds wrong, that is real information. If you feel chest pain, ask them to notice your color, sweat, breathing, and alertness. Small observations can guide big decisions. Now let's pump the brakes for a second. I'm not saying this to scare you, but the wrong healthy response can make an emergency worse. Do not force yourself to stand after a hard fall if your hip, back, or head hurts. Do not drink water if you may be having a stroke or are drowsy. Do not chew aspirin for every emergency, especially if you have stroke symptoms, a known aspirin allergy, stomach bleeding, black stools, vomiting blood, or a bleeding disorder. Do not take someone else's medication, and do not drive yourself if you feel faint, weak, confused, or short of breath. If you are on blood thinners, have kidney disease, use insulin, or have had strokes or heart problems before, your emergency plan should be even tighter. Keep your medicine list current. Keep your phone charged. Keep your glasses where you can reach them. And if you live alone, consider a wearable alert button. That is not weakness. That is backup. When should you seek medical help? Right away? New chest pain lasting more than 5 minutes? Sudden trouble speaking? Sudden numbness or weakness on one side? Sudden severe shortness of breath? Passing out? A fall with head injury? Heavy bleeding? A blood sugar that stays low after treatment? New confusion? New blue lips? New seizure? These are not watch and wait symptoms. So you're convinced but thinking, how do I actually do this? Keep it simple. Tonight, write one emergency card. Put your name, address, medicines, allergies, and emergency contact on it. Put it by the phone. Tomorrow, practice the script out loud one time. My name is underscore, underscore, underscore. I am underscore, 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 underscore. My symptoms started at underscore, 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 underscore. That short practice matters more than you think. Then build the easiest daily routine. Keep your phone charged above 50%. Wear your alert device if you have one. Put your glasses, walker, and slippers in the same place every night. If you have diabetes, keep glucose tablets by the bed. If you use nitroglycerin, keep it where you can reach it fast. If money is tight, use an index card and a zip bag. You do not need expensive tools. You need a repeatable system. Look, there's a lot of noise out there, a lot of fancy advice, a lot of fear, but this is one area where simple beats complicated. You don't need to overthink this. You need to remember one thing. In the first 3 minutes, stop moving, call first, prepare the space, match the move to the symptom, and say the time out loud. Start with just one step, that emergency card by your phone. Your body will tell you if it's working because when panic hits, simple routines are the ones you can still follow. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.